welcome to The Social Doctor, and this is Dr. Ayushi. The Social Doctor is a platform for the doctors, by the doctors, where we discuss journeys, experiences, knowledge from the successful medical practitioners. And today we have Dr. Neetu Singhal with us. She is a consultant pediatrician in Gurgaon. After her MBBS, she moved to UK where she cleared her MRCP in pediatrics as well as did her fellowship in neonatology. And now she's here to talk about her journey of moving to UK. How was her experience? What all did she learn from there? And everything around that. So all you doctors who are planning to move to a different country, this is going to be a deep, insightful conversation for you. Welcome, Dr. Neetu, to our platform, The Social Doctor. So, tell a brief about your journey. How did everything start?
Yeah, hi, myself, Dr. Neetu Singhal. I did my MBBS from Mysore Medical College and I finished my internship in 2002. Then all of a sudden, I just made up my mind to rush to UK rather than, working and sticking on in government hospitals in India. And I started my work in UK in 2003. First, you have to give IELTS, which proves that you can speak English in UK. And then you clear PLAB 1, PLAB 2, and then you start applying for the jobs once you get the General Medical Register certificate from the UK. I worked there in different fields when it comes to neonatology, where I started my first job as senior house officer, which is equivalent to a junior resident in India. And then I got job in pediatrics, and then I got offered for 6 months in pediatric surgery. But then I got most of my experience in UK in neonatology. I did my fellowship in neonatology in Aberdeen University. And side by side in UK, we give MRCP, CH for our post-graduation. But then after 5 years of my working from 2003 to 2008, I made up my mind to come back to India. And I got married. Then I took a small maternity break, and there are a few things which go up in India. And then I started my work again in Fortis Hospital, Jaipur, for a year. In 2013, I moved to Gurgaon, and since then I'm sticking to my clinic, the Vedanta Child Clinic, and I'm taking full interest in my private practice, where I'm visiting consultant in a couple of hospitals in Gurgaon.
Yes. I'm sure, she's doing amazing. I know her personally as well. So now, doctor, you moved to UK very early in your career after your MBBS. Now what do you think? Was it a good decision on your part, and how was it?
Yeah. If I talk about that time, because I'm talking about 2003, at that time, we used to see many of our seniors from medical college, they're going to UK, they're giving the PLAB exams. And somehow I was thinking of starting the preparation for the Indian PG, and one of my friends who was working in UK, he just called me up and he offered me, he'll guide me, and so I just thought, okay, just let me take a chance. So I didn't have any other reason that I'm going to get married there or have my family there or anybody, but it's just being, more of experience. Yeah. I just thought of, let me go to UK. Mm-hmm. And if you ask me retrospectively, it was not that bad as an idea, because then I got chance to, explore myself independently. Mm-hmm. I was not pampered there. I was in UK all the way alone. So there is, as in with any decision in life, there is some plus and some minus. Mm-hmm. So, but yes, I would say that there was no particular reason for me to go to UK. It was just a random decision.
Okay. But still, now I agree that you think that it was a good decision at that point in time. But what do you think if a student plans it now? What is your point of view?
All I guide at this stage is that think 2 times. Okay. That's it. I would retrospectively, I can say that I should have taken, done my post-graduation in India after my MBBS. And then if I go to UK, that would have been better. Because for any reason, whether personal reasons or professional reasons, at any stage in your life, if you plan to come back to India, there we lose one point in our life where we call the post-graduation from India. There, you feel that, okay, you are behind. Even if you do your MRCP, clinical fellowship, anything, but the tag of an MD or an MS from India, it makes a bit of a difference.
Yes.
So I would recommend, yes, we should always, if you have a genuine reason that, okay, you want to settle for your whole life in UK or US or anywhere abroad, then I would recommend, okay, don't waste your time. But if you have 1% chance of thinking coming back to India also, then I would say yes, stay there for 3 years more, or just finish your post graduation and then you're a free bird. You can go anywhere in the world. Because once you come back at any stage in your life back to India, you have that confidence with you, which I lacked. I
Yeah.
was missing that stamp of MD in India when I came back. And I was like, oh my goodness, in India, I would be considered, equivalent to an MBBS. They would not recognize my degree. So this is bit of a tension we get
I
once you come
agree.
back.
I agree. Especially now when you have started practicing as a specialist, it's very difficult to move back. Yes,
Yeah.
it's true, true, true. So this is a very, very deep insight, that for MBBS students to understand if they're planning to go out. So now, what you have already mentioned, what are the kind of examinations that you cleared to go to UK? It's IELTS and PLAB that you did. Anything that that you can, I understand it has been a long time, but something that you can mention to for the preparation of the exam, it's equivalent to MD examinations, or is it more difficult?
There's no comparison, I would say. They're too easy.
Okay, okay, okay. So if somebody is preparing for MD, that person can easily clear those.
They can just clear this. They don't even need to pick up a book. It's that
Oh,
easy.
okay,
So,
okay.
so it was, I would say, yes, maybe I was being naughty that I just ran away rather than preparing for Indian PG entrance. I just ran away but then from entrance point of view, it is not difficult. But yes, there are few skills which we need to, pick up once we do a practice there.
Okay.
And I would say that it just flows with time because as Indian doctors, we are very hardworking. And even in working in UK, when I was working there, we could see that everybody looks at our pace because they expect a lot from us.
Mm.
I have personal experience from all my senior colleagues that they say that when you Indian doctors are working, we as senior consultant, we don't have to worry. So
Mm.
that's the kind of impression we have once we are working there.
Yeah.
But then, it's like, keep, do we actually want to stay there for the rest of our life or
Mm.
we want to come back? So these points can just come in between.
Can come into
But yeah, IELTS and PLAB, they're not difficult. They are very easy.
Okay, okay, that's glad to know. So now, when you also have cleared your, done your fellowship there. So what are the kind of fellowships in pediatrics that you will always tell students who pursue MRCP there in pediatrics to follow?
Fellowship per se, neonatology, it adds on to your CV.
Hmm.
That I would say that if you get chance to do a clinical fellowship in neonatology, that would add on.
Hmm.
Because altogether, and especially in UK, we have level 2 and level 3 NICU units where you get good experience, where you're getting chance right from umbilical catheterization, intubation, transfers of intensive patients, so it's a good environment there. So in neonatology, if you ask that, even if you think of coming back to India at any stage of your life and you want to be a neonatologist, I would say that right from Aberdeen Royal Infirmary or any other good universities in UK, neonatology practice really helps, really helps.
Okay, okay. And especially now in India, this field has also,
Has
a job
come up.
opportunity.
If I compare this time today to the time when I was in UK, nobody even used to talk about neonatology.
Yeah.
I'm talking about like 2004.
Yes.
But you see today, we have so many of respected DM neonatologists who are running the private hospitals.
Yes.
If I talk about Gurgaon only.
Yes, true.
That's
Every popular hospital has a neonatologist. It's a
right.
must now.
It is.
Yes. So, as you mentioned that there you have worked there in UK. What are the kind of challenges and positive things that you have faced there? So let's start with the positive things. What were the positive things that
I
you
would, I
found?
still miss working in the NHS UK
Okay.
because it's a very professional environment.
Hmm.
The one thing which I really respect being in the medical team there was, we follow the protocols. We
Hmm.
don't just wish and write medicines that I feel like writing the antibiotic. No, I was shocked the way I see the antibiotic and 1,000 medicines prescription in India. I didn't like it much, being honest. But there, once we follow the protocol, it's good for everybody. It's just like, just say, we can see the kind of antibiotic resistance which is coming up in India. And I think our overprescription is one of the main reasons for that. Where in UK, if you have to write any medicine apart from paracetamol or an anti-allergic, You have to be clear. You have to have a reason for that. And I still miss that environment.
Yes, yes,
It
yes.
was very professional, right? From, we are talking to our consultants, we are sharing our feelings, our good experience, our bad experience. So it's more of a good professional environment overall, I would say. But yes, if you ask me, I used to miss Diwali and Holi.
Yes, that's you miss your kind of people when you move out. Completely agree. This
If
is
you
something
want
that you.
to plan to celebrate Diwali there, it has to be a weekend Diwali. You can't celebrate it on the day Diwali is. So that's how, it all depends.
Yes, yes, yes. True, that's true. So now these are the good points. What are the challenges that you faced?
Challenges, yes. The hard truth again, the thing is that Britishers ruled us. And then within heart of hearts, somehow, touchwood, I didn't go through any negative experience myself, but I had few of my friends who were tortured by their British colleagues. That you Indians, you have come here. Why do you grab our seats? What do you think? Go back. These kind of dialogue somebody has, listened in one of my friends' group. So it's all, that that bias remains. But now after 2008, the new setup where they'll select in the NHS as a job offer, they'll offer a European first, then a non-EU, and then comes an Asian. So even if I'm going for an interview where I perform much better, they'll give job to a German who needs an interpreter, who
Hmm.
doesn't know English. But just because he is from a EU, so he'll be offered the job. So these kind of, feelings, I would say that it
You
gave
don't
me a
care about it.
I
Yes,
didn't do
yes,
it at all. Yeah.
yes.
And this was one main reason that made me come back to India also, apart from thinking of marriage.
Hmm.
Yes, I was like, no, if it is a clear bias where I was the right candidate for that offer, and they're just giving because of those rules, so I couldn't stand it.
Yes,
So,
yes.
so my advice to everybody would be to be prepared. If
Hmm.
we expect too much, then we sometimes feel a bit shattered.
Hmm.
We should know that there is 50% good, 50% bad in all decisions. Even if you plan after MBBS, even if you plan to continue in India, there is some difficulty in India also, but then there is some good points also.
Yes.
Same way, if we plan to go to US or we plan to rush to UK, Australia, anywhere in whole world,
Hmm.
everywhere there is some plus and minus. So one thing which I missed out, I wish I could have somebody who could have guided me in advance, was be mentally prepared, because I was too emotionally hurt at that time, which I
Hmm.
don't want anybody to feel though. Because let's accept the hard truth that
Correct.
okay,
Correct. Hmm.
my experience is that all our UK British consultants who were from there, they
Hmm.
used to love when they are working under them. But the kind of smile I used to see on their face when they are talking to their own student, that used to give me a drift. But then, I used to tell myself, it's okay. But
Hmm.
then, we have to accept this hard truth. Don't expect that you will be loved as much as any of your colleague. No. So
Yes.
so that sometimes over expectation gives us a sad feeling.
Yes.
Few of my friends, who went with me at that time only,
Hmm.
they came back to India because they couldn't tolerate that.
Hmm.
So it all depends how much of the patience you have.
Yes,
Huh?
yes, 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 yes. Yes, that's true. You are being treated as a second citizen, which is not, at times not acceptable.
So
True, true. So, the other day, yesterday when we were talking, you also mentioned that there was a, because of the new rules in 2008, there are many of your colleagues who have started working as a general physician, and what are
yes,
the kind of that challenges that, if you
it's I would say the biggest professional. It is the biggest hazard
want.
where you have done your post graduation there. Few of my friends, they have done in PhD also.
Okay.
After all that post graduation, MBA also as a side thing, and what are they doing today? General practitioner, which is equivalent to MBBS in India. So where have we wasted those 10 years of our life? It's countable. And GP is not one of the much respected job, because I respect being a GP if you want to be a GP. But I remember when we were in the college there, in the hospital there,
Hmm.
and we used to get the reference letters from GP. We used to, it's a common trend in the NHS environment that we used to say, oh my God, what the GP doesn't know this.
Hmm.
But if I say retrospectively, if I would have been in that position being a GP there, how insulting we feel, after doing so much of training, you are just being a general practitioner.
Yes.
So if you have that mind that, okay, you're happy to be a general practitioner, I would say there is MRGP, which is like membership of the general practice there.
Okay.
We'll start with that rather than, going any zigzag.
Okay.
Because after the 2008 rules, being a consultant in UK is, I think reaching Mars or Venus. It's not that easy anymore. I have come across few of my seniors consultants who are from India, but since last 10 years, I would say, nobody has been promoted to being a consultant. The maximum you can reach there is being a clinical fellow or a senior resident, and that's it.
Okay.
So the dream of being a consultant in UK is, I would say, too difficult these days. If you start from the basic. Yes, after this 2008 rules, there was so many changes in the PLAB. The number of PLAB exams cut down to, I would say, 10%. So these days, I'm getting to know from many of my colleagues there that they're welcoming for locum consultants.
Okay. Okay.
So that is one thing different. But then how much professional satisfaction you get from that is, difficult to say.
Yes. 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 True. After some time, when you don't get professional satisfaction, it gets very difficult to do your work. Yes, that's another very big insights that you have mentioned in this. Anything else? Yes.
In fact, I would like to share a very important message that my husband, he did his PG from AIMS. So he came once to UK and he met his senior there who was from AIMS in ophthalmology. He
Okay.
was the first person to just tell him clearly that you're not coming to UK.
Okay. Okay.
Because from once we are doing from a good institute in India, you want to move ahead in life. And once you come to UK, after 10 years of working, you'll be sticking at one level and there is no promotion. There is, you can't think of moving ahead. But in India, he was comparing himself to his colleagues of that batch.
Match.
That
Yes.
once I go back to India, I really feel jealous looking at the way they live. They have their working. 1,000 people are, surrounding them in their hospitals. So profession after initial few years look awesome there, but after that, I think we start, missing that professional satisfaction, which sometimes I get in touch with my colleagues in UK who are continuing there being GP or junior doctor or anything, and everybody is, they are not happy professionally. Yes, few of them, they are happy being a GP. So so it all depends, there is no 100% negative thought about it. But then, all the important, I think the only message which I want to share with everybody is, please be mentally prepared for everything. Don't be stuck about, no, I have to do this only. Where we over expect now, sometimes we get shattered more.
Yes.
That's it.
Yes. Yes. Yes.
Just flow with the time and that's it.
Yes. No, actually, this is also one thing very, very well said by you. If somebody wants to go to UK, it's better to be a general practitioner than to go round and round and try to become a consultant. Because when it is difficult to be that, why to spend so many years? Better settle down with something that is easy, and that is what is going to happen in future.
True.
That's really really deep thing that will be helpful for the students who want to travel to UK.
I'm trying to discourage. But then one thing which I would actually say again and again is, just be prepared for everything. All the good part, all the hardships. First day when I went to London, we all think that, okay, it's Big Ben there, it's awesome. But then finally for training where I had to go was equivalent to, Sadar Bazaar in Delhi. It was such a, a remote corner of London that I felt ashamed. Oh my God, I have to go there for my training. So we should be like, so that's why, I mean, the kind of negative feelings I got at that time. So we should be like, get in touch with any of your senior colleagues there if you get chance, get in touch with senior consultants, or I'm more than happy to guide. But then just explore and then take a step. For my decision was too random. I didn't think 10 times. I just, I got an offer and I just went to straight away apply for the IELTS.
Yes.
But if you take me back in 2003, I might take some time and explore more. So that is one mistake I did.
Yes. So guys, if you plan to go to UK, please, or if any of your friends or colleagues are planning to do that, please make them, share this video and make them listen to this, because this is such deep insight that will help them tremendously, because this is something that nobody is going to tell you. It is because Dr. Neetu has been there, has seen there, and has her friends there, know about it deeply. Anything else that you want to share about UK? Because you have shared so many stuff that I am poking you again and again.
The good memories which I have, I shared that from the NHS, right from protocol, time bound. When we say time bound, I mean, I was shocked that 2 minutes to 9, and our consultant used to be there, which I've not seen in India so far, even in my medical school, being honest. And I'm still sticking on to that. We should learn the good parts.
Yes.
So I respect that a lot. And then yes, of course. If I talk about the whole of the medical team, if I talk about the basic culture there, I respect that. The right from the cleaner in the hospitals to the security guard, everybody has a smile on their face,
The
which gives a
positivity around.
positive environment, very positive. Whereas if I compare this to especially the government sectors in India, one of the reasons for me running away was that I don't want to cry once I get into the hospital. So that's one of the few differences which I personally felt. But then, as I said, there is all plus and minus in everything.
And everybody makes their choices. Everybody has a perspective to do that.
And
So
as long as we make a choice ourselves, we are not going to at least repent on that.
yes, yes, yes.
And it was my decision.
Yes, no, completely agreed. And the idea of discussing this with you also is so that people, before making their decisions, understand by your journey of how things turned over for you, so they understand, what are the better things that they can do to themselves.
These days we have Google with us, so you can explore more in detail, about everything.
And actually, there you can find some of the seniors or anybody who is there. That is the best way to know before moving to a country, because once you move there, it's very difficult to get back. There are so many things that have invested into it. So yes, you should think. And if you find this video insightful and useful, definitely share it with your friends and friends and colleagues, because this is something which you cannot find anywhere. This is only because because Dr. Neetu has been there and is sharing with us. So what are the last motivational words that you want to tell the students out there? You have already said so much that I am feeling, I feel myself so motivated. So something that has keep you motivated always, or a principle of of yours in your life.
The only thing which I would say, that keep smiling. Even if you are, just having a tough time there, which we all go through at some stage of our lives. But one thing is, the positive mind really helps. And that is going to help us for the rest of our life. You've gone through the test of the most difficult part, doing the MBBS, right from anatomy to physiology. Oh my God, if I still remember those 13 subjects, it's like, all of us feel that way. But yes, keep smiling, and whatever decision you take with your heart, your mind, that okay, you are responsible, and then don't regret. And then the things will help. Don't worry.
Yes.
But we should always keep smiling and be positive.
Be positive. Whatever it is, be positive, because life
That's
is
it.
all about struggles and staying happy with them. So thank you so much, Dr. Neetu, for such an amazing discussion. I loved to have this discussion with you. And I'm sure most of the students must be guided in the right direction, listening to you and listening to your fun way of spreading your message. This was really nice to know. So yes, and actually I'm repeating it again. Do share it with your friends and colleagues, because I find this really insightful. Also, also do follow our Instagram and YouTube page. You can find all our videos there. There are a lot of amazing videos coming up in the coming weeks, Wednesdays and Sundays, which will also guide you on the right track and show you the path if you are confused in any way in the medicine field. Thank you so much, Dr. Neetu, for being here on the platform. It was really nice having you. Thank you. Bye-bye. Good night, everyone. Bye-bye.